Ultherapy, the national average to do the entire face, I'm focusing mainly on talking about Ultherapy for the lower face, but you can do Ultherapy in the upper face. You can do it up in here to actually do a little bit of a brow lift. And we combine this with the Botox and the Dysport and the fillers. It depends on the patient, what I think is going to work best for their facial structure and their issues that they're having. But the national average is $3,500 for the full face. We charge $1,250 if we're going to do the upper face and the crow's feet area, $22.50 for the cheeks, jowls, and the upper and the neck. And we give a $500, if you do both, you get a $500 discount. Once again, we're going to compare us to what would you do if you had a neck lift. Obviously, once again, it's less expensive. If you just do a lower face and neck lift, it's going to be somewhere between $6,000 and $8,000. There's no downtime with Ultherapy. In fact, there's less downtime with Ultherapy than most other lasers. Most lasers leave you sunburned or red and bumpy sometimes for laser hair removal, but with Ultherapy, there's really no downtime at all. The results with Ultherapy can last 1 to 2 years. I think it's actually going to last longer than this. The FDA, when they gave them their FDA approval, that's the most they can claim, but their retro studies are showing that the results actually go beyond this. Lower face and neck lift, believe it or not, because of gravity pulling on this a lot more than the face, neck lifts don't last as long as a face lift. Most women are noticing that this skin is starting to get lax again at about 5 years. Obviously, no needles, no anesthesia, no surgery. This is actually Chris. We did his lower cheek and this area here. If you see, this looks more filled in. It's a little bit subtle, but this fold here is not as deep on this side because as this has filled in, this little hollow he has here and here have gotten less. And we just did this about 2 months ago. So he hasn't even, this is not even his picture that I'll put up another month from now. But this has always been his trouble area that's really bothered him, and it's really tightened this back up. This is a great area. Now that's a patient that I did, obviously. This is not a patient that I did, but this patient, the lower jowl, it's firmed up her, it's made it, this is what a young jawline looks like. As you get older, you get these sulci or grooves and all these necklines. So this patient is lower face and neck. This is the same patient on the side view. And we're seeing results similar to this. We've had a couple patients consent to actually let us use their before and afters, but we're waiting until we get them out to about 6 months before we show them because I want them to be as good as possible. But we're seeing these same results that this patient enjoyed.